Few, and I'm proud to be one of the authors for an up-and-coming publication in the Aesthetic Surgery Journal, July issue 2015. It's titled A Multicenter, Single-Blind, Controlled Study for a Volumizing Hyaluronic Acid Filler for Midface Volume Deficit, Patient-Reported Outcomes at 2 years. This is a study that I think most importantly looks at outcomes from the patient perspective. And I'm particularly proud to share data that really emphasizes both the patient perspective, looking at multiple areas, from things as basic as their perception of youth. What we see is even out as far as 2 years, that roughly 55% of patients felt that they look younger than their stated age. Another interesting finding from the study is that with the use of a midfacial volumizing agent, that we see improvement in areas like the tear trough or nasolabial fold. I think interestingly, we, in particular for the tear trough, are finding from this data set that 3/4 of the subjects felt that their tear troughs were significantly improved as compared to pre-treatment, even though there was no filler placed in the tear trough. So what I feel this clinically brings to us, which is new and important, is the fact that if somebody has a tear trough and they have midfacial volume deficit, we fill the midface first and then reassess the tear trough at some point after the midface has been restored. I think this is a revolutionary way of looking at the central face. Another important factor in this publication is the fact that it really includes all skin types. So from skin types 1 through 6, and in fact, actually skin types 5 and 6 represent nearly 1/4 of the subjects in the study. I think lastly, the point that is most dramatic to me is the fact that this is a study that shows that actually the physicians who were rating the subjects felt that the overall improvement was actually rated slightly lower than the subjects. And so I think even as inherently in any study there would be bias, there appears to be very little bias in this subject. What comes next from this as a result of this study? I think that we're going to start looking at areas that are perhaps off-label, such as the temples and the chin, and looking at really the outcomes from a patient perspective.